Good afternoon, everyone. My name is Kevin Friard. I am on the board of directors for Rare New England. My company, Salem Oaks, is dedicated to empowering patients to shape the future of medicine by helping them understand biopharma R&D, the process, the people, and the decisions they can influence. Please visit our virtual booth in the exhibit lounge if you haven't been there already. It is my great pleasure to introduce Dr. Danny Sands from Beth Israel Deaconess Medical Center. Dr. Sands has worked in a variety of capacities in healthcare IT for over 25 years. He holds an academic appointment at Harvard Medical School and maintains a primary care practice at Beth Israel, in which he makes extensive use of health IT, much of which he helped to introduce. In addition to practicing, Dr. Sands works with a number of innovative companies and is a co-founder and the chief advocacy officer of the Society for Participatory Medicine. I first learned about SPM in 2018 when I realized most of my new patient advocate friends were members. As Danny will explain, the mission of SPM is to help patients and healthcare professionals actively collaborate and encourage one another as full partners in health. For the rare patient or parent, participatory medicine is a way of life. They must actively participate with or even lead their own care team. However, their doctors and other healthcare providers may not be accustomed or prepared for working with such strong partners. SPM wants to change this. Please welcome Dr. Danny Sands and be participatory. Ask your questions in the chat panel below. Take it away, Danny.
Thanks very much, Kevin. Hi, I'm Danny Sands. Thanks for the introduction. I'm happy to be here at this important conference. I'm going to weave in the importance of participatory medicine to patients and caregivers dealing with rare disease throughout this presentation. I have kind of a lot of material to cover, so I am going to share my screen and get cracking. Okay, I'm assuming everybody can see my screen since we did a test a little while ago. So I've entitled this, Whose Life Is It Anyway? Why Participatory Medicine is Needed for Patients with Rare Diseases. And I can click the right button. There we go. I want to point out that the healthcare system that we're dealing with, not just in the US, but particularly the US, but all over the world, healthcare is in crisis. And it's in crisis for a number of reasons. And I don't have time in this short presentation to go through these in much detail, but the epidemic of chronic disease, aging population, rising expectations, rising costs, complexity, poor information exchange and coordination, lack of trust, and declining patient satisfaction. Despite all of this that's going on, all of these crises with the healthcare system, we think about healthcare as if it were a car wash. And when I say we, I mean people on the patient and caregiver side, patients in the on the health insurance side, the provider side, the doctors. We all implicitly think that, oh, the healthcare system is basically a car wash. We don't say it that way, where the patient is the car and is unhealthy or dirty, and enters into that healthcare system and gets healthcare sprinkled on them as they cruise passively through the healthcare system. And somehow they come out the other side healthy. Well, that's ridiculous. Although that's kind of what we've encouraged, we thought about, we need to think about healthcare differently, because this is the kind of healthcare system, this car wash healthcare system, that results in a lack of high quality personalized outcomes, a lack of satisfaction, high costs, and it's not good for anybody. I think we need to think about healthcare differently. So what's the cure? What should we be thinking about healthcare as? Well, I would submit to you that we should think about healthcare as something totally different. We should think about healthcare as a collaboration on the patient's health. That is, the healthcare professional and the patient/caregiver collaborating around that patient's health. The topic of the collaboration is the patient's health. And that is what I would call participatory medicine. So think about collaborations in your life. Think about your collaborations with your partner, your co-parents, your research partners, your family, whatever those collaborations are. Think about the elements of a successful collaboration. I would say to you that the elements of a successful collaboration, no matter what kind of collaboration it is, include open communication, sharing in decision-making, mutual respect and trust, information sharing, and finally, engagement. And if we get all this right, we can have a successful collaboration in any aspects of our life. We get it wrong, it's just not going to work. And if we apply this to healthcare, think about your relationship with your healthcare professionals. Do you have all these? Again, these are not just things that one person brings to the table. These are things that both parties need to bring to the table. So here's the interesting thing. This is your world. This is our world. This is the world that you live in. It's the world of Apple and Google and Amazon and all these magical things, how technology is making things better and reducing friction. So think about that. Is this how you experience healthcare? I'm going to highlight some data that's about the health habits of US adults when it comes to the internet. 80% of online adults have looked for health information. And every day, more people search for health information online than see a physician. More than half of those people act on that information. And this one bullet point, this section here is probably the most important. The others are less important, but also interesting. People reading about others' health experiences online, people tracking their health information online. If we were live, I'd ask you, how many of you track your health information online? And that doesn't necessarily mean, tracking it through Facebook, but it may mean using a connected digital scale. It may mean using a personal health record. There are many other ways to do that as well. So there is a term that was coined by a dear friend and colleague who's unfortunately deceased, named Tom Ferguson. And Tom defined this term e-patience. And you might hear that now, but the term didn't used to exist, e-patience. And many people think the E is about electronic because it actually came about in the early days of the web. But the E actually is not like email, it's about engagement. Because Tom defined e-patience as people who were engaged, equipped, empowered, educated, and enlightened. And that's what you have the opportunity to be. You have the opportunity to be e-patients. And what we need you to do is step up and be that e-patient to the betterment of your health and your loved one's health. And we need a healthcare system and healthcare professionals who are equally up to that task. So what are some of the things you need to be engaged at a very high level? It's information, it's communication, and it's convenience so that you can be more involved in your care. I'll talk briefly about each of these areas. So let's talk about information first. So I like to think about 3 complementary types of information that you need. So one is general information. I need to know information about my disease. What is this condition that I have? That's type 1 information. Type 2 information is specific information to me. I want to know my health information. I want to know, this is not a rare disease, of course, but if I have diabetes, I don't want to know just what is diabetes, what's that all about? That's the type 1 information. I want to know information about my diabetes. What is my hemoglobin A1C? What are the complications I have? What's going on? I want my record, my health data. That's type 2 information. Type 3 information is orthogonal to both of this. This is peer information and support. It's the experience and knowledge of others like me. So that's very different and still very important. But if you can nail all of these things, that's going to help you be a better partner in your care. I would say that we have a shifting paradigm in healthcare. What I mean by that is that the traditional paradigm in healthcare has been one of information asymmetry. And information asymmetry is a term stolen from warfare and economics. And the idea is that one person holds all the information and the other person doesn't have that information. So in economics, that makes it not a fair situation, right? We try to have more transparency. But in healthcare, this has been the way we practiced for so long, that physicians have the information, patients don't, and physicians are kind of reluctant to let it go, despite the fact that the word doctor comes from the Latin docere, which means to teach. So this is what physicians often felt comfortable with, is that the physicians are the oracle. Okay, knowledge is power. Physicians feel comfortable with this, but I would submit that it's actually an uncomfortable, it's a burden to physicians. Why? Because whenever I speak to groups of physicians and I ask them, how many of you know everything there is to know about your area of medicine? There's a lot of laughter, uncomfortable laughter. Because although we act in our daily lives as if, oh, sure, we know everything about our specialty, everyone knows we don't. So if we need to act like we are the know-it-all, we know everything, then we're kind of living a lie, aren't we? So what we need to do is we need to move to a model of information symmetry. For the reasons that we talked about, everyone's online, all the access to information is out there. And if we can do that, we can think about a different model in which physician and patients are partners. And rather than feeling threatened by this, physicians should feel liberated by this. And they do feel threatened at first, but ultimately they can feel liberated. And we can go back as physicians to being healers again, which is why really we went into healthcare. Most people didn't go into healthcare because they wanted to be the know-it-all. Next is communication. I'm just going to say a little bit about communication. There's so much to be talked about in this area. But there's so many ways that communication is a key to engagement. First of all, there's multi-channel communication. You know, communicating in different ways. I did work many years ago, back in the 90s, using email with patients and how powerful that was and how comforting it was to patients and useful all around. But by offering different channels of communication, not just face-to-face, but different types of messaging, secure messaging, telemedicine, whatever, improves access, it's convenient, and we avoid the tyranny of the urgent. That was a phrase from Stephen Covey, who, you know, because when we get something that's right away, like a phone call, we've got to just deal with that right away. And there are many situations in healthcare where we need to take a step back and reflect on what we're going to ask or how we're going to answer. Shared decision-making is another aspect of communication. It reduces anxiety, it leads to faster recovery, and improves the adherence to the plan. If you're engaged in making that care plan, you're going to be probably participating in it better. Cultural sensitivity. We need to make sure that we're culturally sensitive to increase health equity and respect. And another type of communication is how we communicate in the office when we're using an EHR. That darn electronic health record that both patients and physicians are complaining about, it actually doesn't have to get in the way of communication. And there are guidelines about how to use this effectively in the office to improve in-office communication, improve education, lead to better listening and better diagnosis and management. So what about convenience, the last bubble? Well, how many of you, just to not to put too fine a point on it, how many of you stand in line to withdraw money from your bank, right? Who does this? I had to find a picture from many years ago to illustrate that. We don't do that anymore. How many of you make airline reservations through a travel agent? Well, we don't really do that much anymore either. Because what has happened is that technology has changed these work processes. It has disintermediated the bank teller and the travel agent. So as this has transformed our lives, why hasn't the same technology changed healthcare. Because this is what so many patients are confronted with when they try to make an appointment. It's got to change. It's just got to change. If we want patients to be partners in their healthcare, if we want better outcomes, lower cost, better satisfaction, and so on, we need we need to improve all of this. And I would say, and I did this, patient portals. This is part of the answer. This is a technology foundation. I helped create one of the nation's first patient portals at a health system in Boston, which is still in use today. It's called Patient Site, and you can visit it to do a little demo. But you all know what a patient portal is. Well, what is it? Well, it's something that provides secure email, allows messages to be routed within the practice, tasks to be assigned, so you know who's handling your message. It reduces the friction for common transactions like prescription refills, appointment requests, referrals, and so on. It allows you to pay your, I linked to the wrong area here, I apologize. It provides education, it allows you to search for information, it allows for information, prescriptions, and so on. And it allows you to see your records online. It allows you to securely see your records from all over the health system. And yes, I know someone will ask me this, it is a problem that you're only seeing health records within that system of care. So if you're going to another practice, you may not have access to those records. And that is a problem that we have in the US. But it is good, especially if you're getting care in all one place. You're seeing the system's records, you see your appointments, and now you can even see your notes online. So another piece of this sort of communication is that health happens between, or of convenience, sorry, is that health happens between visits. We need to think differently about healthcare. And just an illustration of this, we could talk a long time about this. This is a graphic that was developed by Sarah Rigora. And Sarah Rigora is a person, a woman in Sweden who has Parkinson's disease. And she's also a designer, a graphic designer. And she put together this illustration. What you see on your screen, it looks like a big light blue square. But if you look closely, you'll see that that square is made up of blue dots. And each of the dots in that square represent an hour of her life. And in the magnification, you're seeing that there's actually one red dot in that big blue square. And Sarah observed that to manage her Parkinson's disease, she spends 1 hour in neurologic care and 8,765 hours in self-care per year. And you know that as people living with rare diseases, you absolutely know this, because no matter how sick you are, and some of you may be very sick, you're not seeing your doctor all the time. Even my sickest patients are definitely not in the healthcare system all the time, as many appointments as they have and hospitalizations and so on. So there's this huge amount of time when they're taking care of themselves. And so patients need tools to take care of themselves because health happens between visits. And if we were really a functional healthcare system, we would figure out how to help you with that and how to gather data from that between visits time. Something that my friend and colleague, Patty Brennan, who's the director of the National Library of Medicine, she calls this the care between the care. So then it gets really interesting, because then you get into this realm of patient-generated health data. So how can you generate health data that can help you work with your care team to take better care of yourself? And I could give a whole talk about this, but it's not just about the cool technology you're seeing on the left, which is pretty cool, admittedly. But there's quantitative data. There's qualitative data. How are you feeling? Are you taking your medications? Are you short of breath? What have you? There's biometric data. There's self-testing data, which, by the way, is just sort of blowing up. There's just so much to it. You know, what started with at-home pregnancy tests has become a whole host of home testing that one can do. Genomics data, requested versus unrequested data. What do we do with that? You know, because you might be generating a lot of data, but how do we filter that and get that back to your care team? How should physicians be monitoring this information? How should they get paid for that, frankly? What is the liability for data that you're collecting and maybe sending to me? Am I liable for reviewing that and making sure there's no danger signs? What about how do we pre-process and filter that data? How do we incorporate it into your electronic health record? How do we ensure the accuracy? How do we deal with follow-up testing? How do we deal with patient anxiety? Huge number of issues that we need to think about. But think about these things we must, because this is a critical piece of healthcare that we're currently missing. So collaboration in the ways that we've been talking about between patient, I'll say patient slash caregiver, and their healthcare professional leads to benefits. It leads to reduced costs, improved satisfaction, and better outcomes due to improved adherence to care plans. And that achieves the triple aim. That is the triple aim that we talk about in healthcare. This is the goal, the Holy Grail. Another one of my deceased mentors, a wonderful man named Warner Slack, who some of you may have known. He was a Harvard professor, did a lot of terrific work. He wrote, "The largest and least utilized healthcare resource is the patient." Now that is such a profound statement, and it really sounds, cutting edge and unbelievable today. And what's really remarkable is that he wrote this in 1976, such a long time ago. And yet we haven't really fully appreciated this. And every day I hear stories of patients, many times are the members of the society that I communicate with, who are really not treated well. They find it very difficult to get their records. They find it very difficult to make an appointment to get their healthcare professionals to do shared decision-making with them. So much more could be done. We should be listening to this. And again, this is not new. He was a pioneer for sure, 1976. Let me make a few statements about guidance for patients with rare diseases. So I'm going to distill it down this way. Find a participatory doc, healthcare professional, if you like. Find that participatory doc, and if you're not finding someone who you are comfortable with, then find someone else. Now, I totally understand that not all of you live in Boston, where I do, where you can trip over a specialist on the street, okay? You don't always have your choice of a specialist, particularly if you have a rare disease, but do your best to do that. And find a caregiver or advocate, because in our healthcare system, especially if you have a complex or rare disease, you can't do this alone. You may already have a caregiver, and that caregiver may be your advocate, but the point is you need someone there with you at the visits, because there's a lot of information exchanged and there are questions that come up, and it's very hard to do all this as a patient, particularly when you're struggling with a complex or rare disease. Then learn everything you can about your condition. Learn the type 1, type 2, and type 3 information that we talked about. This is going to make you understand better and participate at a different level too with your doctor. I think there is there are many doctors who will say, well, it's too complicated to teach this person who's not a medical professional all they need to know about this condition, so I'm just going to do veterinary medicine. I'm going to tell them what to do. I'm going to do things that way. But it does not have to be that way. You can learn about your condition and you can actively participate. And that is a wonderful thing, believe me. That changes the level of the conversation. Next, prepare. And preparation is interesting because I think that so good physicians do prepare for visits. That is, before you come in, your physician is reviewing the last test that came back, reviewing your last office notes, looking at your overall problems and medications and so on. So there is a preparation that generally takes place among healthcare professionals. But the idea that patients should prepare for visits may be a new concept. But it's so important to do that preparation. You should be doing the same thing. Review your medications. Review your last visit notes, since most of you can look at your notes online now. Write down any questions you have, any symptoms that have come up, or so on. But you also have to prepare for being between visits too, so that you are ready when you leave your doctor's office and you know you're not going to see that doctor for another 3, 4, 5 months. You got to know what you should be doing, what data you should be gathering, what you should be watching out for. Next, it's about data. Gather your data from every source, wherever it is. Manage that data and offer to contribute that data to your healthcare team. And finally, engage. Engage with your care, with the care processes. Engage with your healthcare professionals. Engage with health. Now, when I say engage with healthcare professionals, often this is misunderstood. And it's misunderstood on both sides because physicians sometimes misunderstand this too. This doesn't mean, oh, the patient is always right and I need to be in my face and very aggressive with my doctor. It doesn't necessarily mean that. You know, I think if we have a mutually respectful relationship, I try to understand where you're coming from. I meet you where you are, and you need to understand kind of where I'm coming from too. Then what we can appreciate what we can appreciate is that I may be a healthcare professional. I may be an expert in medical care in your condition, but you are an expert in you. And that's what you're bringing to the table. This engagement is an engagement. It's more like a conversation. There needs to be a conversation. There needs to be a meeting of the minds. This isn't like, oh, you know, whatever you say goes. It shouldn't be like that. It should not be confrontational. It needs to be a collaboration, a partnership. Which brings us to the Participatory Medicine Manifesto. So you heard a little bit about the Society for Participatory Medicine. This is a nonprofit organization that I co-founded back in 2009. And we have members who represent everybody across the healthcare spectrum. We have a lot of patients and caregivers. We have health coaches and advocates. We have doctors, we have nurses, health educators, pharmacists, healthcare executives. So really diverse membership. And what we're trying to do is change the nature of healthcare from that of being a car wash to being a collaboration, working together. So we're reimagining the dynamics of healthcare and trying to transform the culture of healthcare. A couple of years ago, we engaged in an exercise to involve a lot of people with these diverse viewpoints to develop a manifesto, a set of rules, a set of guidelines. This is what we believe. And what we came up with through these multiple iterations is we came up with 5 bullets. And the way these are done is that we pledge, no matter who we are in healthcare, I pledge my commitment to the Participatory Medicine Manifesto and promise to do the following. Share and listen, respect one another, share information responsibly, promote curiosity, and be a team builder. So each of these things has a set of actions based on who you are, what your role is in healthcare. Are you a patient? Are you a caregiver? Are you a healthcare professional? Are you a researcher? So if you look at our website, and I encourage you to sign the manifesto, you don't need to be a member. I'd love you to join, but go to signthemanifesto.org. And what you'll see is this and additional information about it. We want people to sign on to this. We want people to understand it. And we want people to bring this to others, both peers and people on the other side of the table, the people at your healthcare institution, the people you're interacting with. So the Society for Participatory Medicine is at participatorymedicine.org, but you can certainly get to it from signthemanifesto.org. So I think we have a lot of opportunity ahead, despite the challenges that we have in healthcare. We have the aging populations, burden of chronic disease. It's straining our nation's healthcare systems and financial resources. But if we view patient care as a collaboration, it can open our minds to healthcare transformation with the patient at the center. And it's essential to improving trust, outcomes, and satisfaction. And participatory medicine is particularly important for patients with rare diseases. So I'll leave, I guess, a couple minutes for questions and discussion in the chat, or you can, if they'll let you turn on your voice, that's fine too. This is a book. This is a patient of mine on the screen. He goes by the name Epatient Dave. He has a great story to tell and is a great storyteller. But he wrote a book called Let Patients Help, and I wrote a part of that book for him. So I encourage you to seek that out. It's not a long read, but it is really great. So this is how you will contact me after if you need to. I'm happy to engage in conversations, and we'll open up for questions. Thanks.
We don't have a lot of time for questions. But one of the things, Danny, I know people in the rare world are very likely to already hit many of the E's in the e-patient. They're engaged, empowered, they're educated, and probably they're experts in their diseases. But how might they help their healthcare providers be better partners as they work through this?
Well, that's a really good question, Kevin, because yes, this is the problem. I think patients in rare diseases many times have already learned how to be that e-patient. But I think part of this is the mutuality of participatory medicine, which is that try to understand your physician, try to understand their lives, the pressures that they're under. Not that I'm saying, oh, poor physicians, you're the ones living with the disease. I get that. But still, if we're going to have a useful dialogue, we got to understand where the other is coming from, both sides. So I think that we need to understand the other person so that we can engage them in a conversation. And I think that we can push them. So when we talk about participatory medicine, we talk about something that's mutually reinforcing, so that I'm encouraging my patients to be more engaged, more e-patients. And patients should be encouraging me to be more engaged. And so it's going to be little prods, not big in your face prods, but little pushes. And in fact, sharing with them even the Participatory Medicine Manifesto. We can have this printed out. You can say, hey, doc, I thought you might be interested in this, whatever it is. And there is education available. We can, the Participant Society does some education of physicians, but it is a process. And I think that the reason understanding the physicians is so important is because there are really bizarre and counterproductive pressures in healthcare today that I think we all sort of need to understand and work around. The system is not set up to allow physicians to be as participatory as we'd like.
So there's another question that came in, and I'm going to reframe it a little bit, but one aspect of being in the rare world is the people who can really treat you are even more rare. There's very few,
yes,
experts in these ultra rare conditions. So how do you find the participatory needle in a haystack? How do you find that person who holds these ideas? Is there a place for us to look and say, here's people who've signed the manifesto or whatever?
A really good question. And we are talking about a program where we can have physicians who attest to this, who attest to the Participatory Medicine Manifesto, and then you can look them up in a directory. But you are absolutely right that when you're dealing with a rare disease, the experts in your condition might be in another city, and there just aren't too many of them. And so that's a challenge. And so you may have to content yourself with having finding a participatory primary care physician who can then be your interface with these rare specialists. But this is definitely a challenge for the rare community.
Okay, we are out of time, and there's a session waiting, another group waiting. So I want to thank you very much. This was really good. Nice and high energy after people's lunch hour. Loved it. Thanks a lot, Danny.
All right, good. Take care. I look forward to hearing from you all. Bye.
Bye-bye.